Hello friends, starting with today's lecture. In today's lecture, we are going to discuss the remaining topic, that is the homeopathic aggravation. Topic number 34 from Kant's philosophy. And in previous lecture we completed the half of the topic, and in today's lecture we are going to discuss the half topic. So in previous lecture we discussed about what is the view of Dr. Kent regarding the homeopathic aggravation. And in this, he took the first reference of aphorism number 154 and explained that a disease that is of no very long standing ordinarily yields without any great degree of suffering to the first dose of this remedy, which is to say that in acute disease we seldom see anything like striking aggravation unless the root disease has drawn near death door, or very severe unless it has lasted many days and breaking down of the blood and the tissue is threatened and has taken place. So in that cases, the diseases which having the severe tissue changes and the severe pathological changes, in that cases we see a serious aggravation, and the disease condition which are of acute nature of short duration, where there are no tissue changes, where ultimates are present, in that cases we see that this is not having so serious aggravation, but the disease is having the tissue changes very deep and pathological changes. In that cases we will see the serious homeopathic aggravation. And explaining with this, Dr. Kent explained about also this, that uh, the symptoms which are suppressed during the previous treatment, they also exposed while showing the homeopathic aggravation by giving the right medicines. These suppressed symptoms also reappear, and in that the elimination occurs in the patient. So elimination must takes place by, as we know, probably from the bowels or stomachs, by omitting, by expectoration, or by the kidneys. And it is a good sign that our remedy is acting. Then in next para, Dr. Kent explained the two examples. First one, that is the limb paralyzed from neuritis, and second one, that is the paralysis of the brain of a child. So in that cases, when the nerves are paralyzed and when we are prescribing the right medicine, that right medicine act on that nerves, and that nerves gets into activity, and due to this activity there is a severe tingling present in that patient. That tingling is so severe that patient cannot sleep whole day and night. But at this point the physician must be firm, and he should confident about his treatment, that is our remedy is acting, and you have to wait and watch. So in that cases, even though the patient is suffering so severely because of that tingling, in that case the physician do not repeat the medicine or do not change the medicine, is the main indication of that. That is, the physician must have a iron hand on the part that is required for the good treatment. Even though the patient is so severely suffering, in that cases you have to remember that the reaction, so that all over the benumb parts, or where the blood begins to flow into parts where the circulation has been feeble, where the nerves take on sensation again, we have reaction which is but the result of that turning into order. That part has been benumbed and dead, and when circulation takes place in the part, in order to repair its tissue, we have reaction which is attended with distress. If a physician cannot look upon that and bear it, he will have trouble. He If he thinks it is an indication for another remedy, he will spoil his case. That is, in that case the physician has to wait and watch. That will lead to the cure, but in that case if he repeat the medicine or give the another dose of medicine, that will spoil the case which is acting very nicely. So This is the two examples explained by Dr. Kent. Then in next para, Dr. Kent give there is a difference between the ultimate disease and the absolute weakness of the vital force, and in this there is such a state as weakness of the economy, and there is such a state as activity of the economy which much tissue change. So in that case, then he explained one example regarding the consumptions, and along with this he differentiate between the oversensitive patient and the vigorous patient. That is, oversensitives, you know, are such are as capable of proving everything that comes along. That is, oversensitive patient proves every remedy they get, and you must know whether the patient is oversensitive and the proving the drug, or whether he has a vigorous constitution and is getting an aggravation. So you have to must differentiate between the oversensitive patient and the vigorous constitution. Then in next para he give the different opinion regarding the repetition of the dose. That is, you will find as a general thing in acute diseases that if a slight aggravation of the symptoms comes in a few minutes, you will hardly ever think of giving another dose. That is, if the symptoms appear in first few hours, there is no need of giving the another dose of medicine, and in this you will say that you have selected the remedy is correct, and the remedy is so similar and searches so thoroughly that it is hardly ever necessary to repeat it. Now there are circumstances when it is necessary to repeat, but this is so difficult to teach and so difficult to lay down rules for that. Only safe plan is to be begin cases without repetition. That is, in that cases it is very difficult to told that in that cases you have to repeat, in that cases you do not have to repeat. These all things are very difficult to teach, but and they are so difficult to lay down the rules for that. The only safe plan is to begin cases without repetition. So you have to begin the cases without repetition, to give a single dose and wait and watch its effects. That is, you have to prescribe a single dose of medicine and you have to wait and watch its effects. So I very commonly give in vigorous typhoid fever. In that he explained the example, that is of typhoid fever, intermittent fever and remittent fever. So in remittent fever, reaction come in very few hours, but in intermittent fever it will took some time. So in that cases you have to wait and watch. So this is the view of Dr. Kent regarding the repetition of the dose of medicine. Then in today's lecture we are going to start with a next para with a reference of aphorism number 158. And with this, Dr. Kent explained as this trifling homeopathic aggravation of the malady during the first few hours, the happy omen which announces that the acute disease will soon be cured, and that it will for the most part yield to a first dose. That is, when you prescribe the correct medicine to treat the acute disease, in acute diseases you will find the homeopathic aggravation in first few hours, and that first dose is sufficient to treat that acute disease. So in that cases the natural disease can destroy another by exceeding its power and intensity, but above all things by its similarity is the whole truth and nothing but the truth. So that when this slight aggravation occurs, you will seldom, if ever, have to give another dose in an acute disease. When this aggravation does not come, when there is not the slightest aggravation of the symptoms, the patient appears to be gradually better after the remedy. Then it is that the remedy shows that it has not acted upon the same depth, and that relief may cease in the case of an acute disease, and when that relief ceases, the reaction has ceased, and then another dose of medicine is correct practice. So in this, Dr. Kent explained two situations regarding when in acute disease you prescribe the medicine, and in first few hours you see the aggravation, and at that time you will say that the medicine is acting well and it is the correct medicine. But the second condition may be that is you are prescribing the medicine, at that time the patient is feeling better without any aggravation. That is, patient is feeling better without any aggravation. So at that time you will think that the medicine is acting partially, that medicine not acted upon the same depth of the disease, so that the relief may cease in the case of an acute disease. That is, what are the symptoms that may be subsided for some days and that can be reappeared after some days. So when that relief ceases, the reaction has ceased. That is, when the relief ceases, symptoms are disappeared, at that time the reaction also ceased, and then another dose of medicine is the correct practice. So at that time you have to give the another dose of medicine to the patient. Then in next para, Dr. Kent explained as relief that begins without any aggravation of the symptoms does not last so long as in acute disease as when an aggravation has taken place. That is, relief that begins without any aggravation of the symptoms does not last so long in an acute disease. So when an aggravation has taken place, a slight action of the remedy over and above the disease is a good sign. So in that case, a slight action of the remedy over and above the disease is a good sign. Again, you will find if your remedy was not perfectly similar, you will not get an aggravation except in oversensitive patient. That is, if your medicine is not perfectly similar to that case, you will not get an aggravation except in oversensitive patient. That is, you know that oversensitive patient that prove every remedy they get, and then it is a medicinal aggravation. That is, the medicine when acted partially, it may show some medicinal aggravation at that time. When you find that you get no aggravation of the symptom in a good vigorous constitution, none at all, very often your remedy has been only partially similar, and it may require 2 to 3 such partially similar remedies to finish the case. So when medicine is acting partially, in that case you require the 2 or 3 such medicines to complete the case or to finish the case. If you will observe the work of ordinary physicians, you will notice they give 2 or 3 remedies to get their patients through, where a master gives but one. That is, the ordinary physicians give the 2 or 3 medicines at a time, but this is the not rule, and our master Dr. Hahnemann only guide to us, that is, give only one medicine at a time. So in next para, Dr. Kent give the reference of aphorism number 159, and he explain about, that is, the smaller the dose of homeopathic remedy, the slighter the apparent aggravation of the disease, and it is proportionately of shorter duration. That is, with the reference of aphorism number 159, in which it is explained regarding the dose of medicine, and in dose of medicine it is explained that the smaller the dose of homeopathic medicine, the slighter the apparent aggravation of the disease, and it is proportionately shorter duration. That is, what is the explanation of it? That is, when you prescribe the small dose of medicine, that small dose of medicine causes a slight homeopathic aggravation, and it is for short duration. but this was written at the time of Hahnemann's experience with what might be called small doses ranging from the lower potencies to the 30th and the seldom much higher. So in that case, this is written by Dr. Hahnemann with his experience during his time, and during his time the lower potencies ranging from, that is, up to 30th potency, and he had an ample experience with the 30 and occasionally with the 60th, but not with tremendous turmoil that comes from very highest attenuations. That is, at his time he using the highest potency as a 30 potency, and he uses the potencies below the 30 at his time. Then it reads in the correct translation of it, this is incorrect here. The smaller the dose of the homeopathic medicine, the less and the shorter is the aggravation. In the first hours, I might be considered to mean an apparent aggravation of the disease. Now, Hahnemann observes, as you will find among several of his writings, that the disease itself is actually intensified and made worse by the remedy, if the remedy be precisely similar. But if we pass away from the crudity of the medicines ranging up towards the 30th potency, we get a milder action, and it has a deeper curative action. And the smaller the dose of the homeopathic medicine, the less and the shorter is the aggravation. The idea is that there is an aggravation in the first hours. That is a matter that the paragraph itself admits, and it is this aggravation that Hahnemann is talking about. So in that para, it is explained with the reference of aphorism number 159, that is, when you select a small dose of medicine, it will give the slighter aggravation and it is for a short duration. This is explaining by Dr. Hahnemann with his experience, and at that time the highest potency he used, that is the 30 potency, and in most of the cases he used the lower potencies. Then it is sometimes true that after the third or fourth potency of belladonna, in a violent congestion of the brain, the aggravation is violent, and if the medicine is not discontinued, the child will die. So there are some examples regarding the use of a high potencies. So when you using the high potencies with vigorous repetition, in that case he give one example, that is, belladonna is a violent congestion. In a violent congestion of the brain, the aggravation is violent, and if the medicine is not discontinued, the child will die. The disease itself appeared to be aggravated. The child seemed to be so susceptible to belladonna that it appears as it were to be added to the disease, but with the 30th potency. As Hahnemann observes, this aggravation is slight and of short duration. Now, in this, we get an outside aggravation. It is the drug of the remedy added to the neutral or a natural disease, an aggravated state of the disease caused by the drug. It is true sometimes, in spite of this aggravation, that the patient says somehow and the other he feels better. So it is the explanation of Dr. Kent regarding the using of a potency. If you use the high potency, in that case you will find the medicine will cause a death in a patient. But if you use the small dose of a medicine, that small dose causes a slight aggravation and it is for a short duration. Then this aggravation is unnecessarily prolonged by giving too low potencies. It is also prolonged by repetition of the dose. That is, if you find a aggravation for a number of days, it is maybe due to the prolonged giving of too low potencies, or it is also prolonged by repetition of the dose. So I recently observed a state that occurred from repetition. I spent a very robust young woman, 20 years old, a dose of brainia to be taken dry on the tongue. However, she dissolved it in water and was taking it at the end of the second day, and when I was sent for, at which time she seemed to be going into pneumonia. She had a dry, harsh cough. What is the matter with my daughter, doctor? Is she going to die? She was proving brainia. I stopped the brainia and next morning she was well. This has been seen a great many times when the medicine was similar. If the medicine is not very similar, only partially similar, it may be similar enough to cure, but you will not see the results that I am now speaking of. But when you make accurate prescriptions and are doing your best work, you will see these things in the very best constitution. That is, in this, to explain the role of the repetition, Dr. Kent explained that is the aggravation is unnecessarily prolonged, and when that aggravation is unnecessarily prolonged in two cases, that is if you use the two low potencies, and the second condition is the it is prolonged by the repetition of the dose. So in that he explained one example, that is he prescribed the one dose of a brainia to a robust young lady or woman of 20 years old, and he explained to take it on a dry tongue, but that woman dissolved it in a water and was taking it at the end of the second day. That is, he repeatedly took that water in which brainia is dissolved, and due to that continuous repetition of the medicine, that create a severe aggravation in that woman. That is, she goes in a state of pneumonia, having a dry harsh cough, and her mother said that is my she is going to die. So at that time, Dr. Kent stopped his brainia and next morning she was well. So this is the condition when you repeat the medicine unnecessarily. When you repeat the medicine unnecessarily, in that case you will find the severe homeopathic aggravation. So I am now speaking of, but when you make accurate prescription and are doing your best work, you will see these things in the very best constitutions. That is, never repeat the medicine unnecessarily. So, of course, the explanation is that the patient is as sensitive to the medicine that will cure her as to the disease that she has. That is, the medicine or the explanation of the patient is that is patient is so sensitive to the medicine that will cure her to the disease that she has, and disease states then are made worse by unnecessary repetition and by the dose not being small enough, that is, by the dose being very crude. The third, fourth, and the sixth are dangerous potencies. If you are a good prescriber, if you are a poor prescriber, you will demonstrate but little of anything. You will naturally go to the higher and higher potencies for the purpose of departing from what seemed to be a poisonous dose. So in that case, the what is the dose of medicine? So in that, when you are using the third, fourth, and the sixth potencies, these are the potencies having a medicine in crude form. That is, that medicines having the crude form medicine in larger amount. But to avoid that, you have to give the medicine in a higher potencies. In that case, higher potencies means you are increasing only the power of that medicine and you are decreasing the quantity of that medicine. And in that case, when you are using the low potencies, that may cause a poisonous effects on that patient. So this action differs from the aggravation of a CM potency. During the later, the patient feels decidedly better. So in next para, Dr. Kent gives the reference of aphorism number 160 and he explained as we are accused nowadays of having departed from Hanuman. Hanuman wrote of the 30th potency in one of the stages of his life as sufficiently high and sufficiently low. That is, Dr. Hanuman explained about the 30th potency. At some time of his life, he explained as 30 potency is sufficiently high potency, and at other uh, other situation of his life, he explained it as a sufficiently low potency. That is, in previous days he used only the lower potencies, that is the third, 4, 6 and 12 up to 30 potency, and in that case he explained that the 30 potency is the highest potency. But after experience of many days of practice, he